Welcome to the Education Zone with me, Fergal Garrity at physiogalway.ie. A big warm welcome from myself, our fellow head chartered physiotherapist Trish, and chartered physiotherapists Emer and Emmett. The Education Zone is all about empowering you, new and existing patients to our clinic. We want to give you as much information on your present injury or illness so you'll be better equipped to deal with that injury or illness. A little history about myself. I have 10 years experience as a chartered physiotherapist. I have an honours degree in physiotherapy, sports science, sports injury and orthopaedic rehabilitation. I have a master's in sports medicine and exercise physiotherapy. I'm a certified strength and conditioning specialist. I'm currently missing in action all the way over here in US of A as I prepare for my board exams for my medical doctorate degree. So meanwhile, while I'm missing in action, I was hoping I could help out in the clinic by posting these short little videos on the injuries and illness that we typically see up in the clinic, and hopefully it'll empower you, the patient. The illness and injury that I want to talk about today is rheumatoid arthritis. Now, it's in the umbrella of arthritic injuries. Now, arthritis, what exactly is that? Well, arthro means joint and itis means inflammation, so literally inflammation of the joint. But unfortunately, arthritis is thrown around a little bit, and there's hundreds of arthritic conditions such as osteoarthritis, gout, reactive arthritis and rheumatoid arthritis. So hopefully today we'll try and differentiate between rheumatoid arthritis and osteoarthritis, predominantly focusing on rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease, and what this means is auto, which is self, and immune, it means we are reacting against ourselves. It's our own selves reacting against ourselves within the joints. Now, our immune systems are there to fight such things as bacteria, viruses, such as when you have a flu. But unfortunately, what happens within the joints of our body in rheumatoid arthritis is our immune system attacks ourselves. So it detects our own self-antigens, or our own self-cells, as being bad. And this releases a cascade of inflammation. And there's loads of cells involved. There's T and B cells. But moving away from the actual science element of it, we're going to look at some of the presentation that we typically see with rheumatoid arthritis as opposed to osteoarthritis. So with rheumatoid arthritis, typically it's the smaller joints of the body. So if we look at my hand here, it's typically the metacarpal phalangeal joint, this knuckle joint, and then the proximal interphalangeal joint. But very rarely is it this guy, this distal interphalangeal joint. And what I'm going to do here is I'm going to show you on this little bone model what I'm talking about. So predominantly affects the wrists. We can see here the wrist here, yeah, and the proximal interphalangeal joint. So this guy here, look at that guy there. And rarely is it this guy here, the distal interphalangeal joint, this tiny little guy up here. Rarely is it that guy, okay? And basically, this immune reaction causes inflammation, warmth and pain within the joint. Now in osteoarthritis, which is more of a weight-bearing disorder, so it's more of a breakdown of cartilage, and it's involved in the weight-bearing joints, such as the larger joints, think more like hips, shoulders, knees, and it's usually monoarticular, and this basically means it's usually one joint. With rheumatoid arthritis, it's polyarticular, it can affect loads of joints, but as I say, it's typically the smaller joints in the body. And often the patient will come and tell us at the clinic that they have a lot of stiffness in their hands, and it takes up to an hour to clear that stiffness in the morning. Stiffness, pain, early signs, sometimes we see a little bit warmth in the injury, but there's erosion and there's breakdown within the joint as it's an inflammatory reaction, okay? So that's rheumatoid arthritis. They're not too sure what causes the injury, and they call that idiopathic in the medical world, which basically means we're idiots. We do not know what is going on, what caused the injury, but there might be a genetic component. There is a gene called HLA-DR4, which is a mouthful, but basically that's on your chromosome 6, so a little in your genetic makeup that might predispose you to having this disease. Also, there has been a bit of recent research on smoking, that smoking might be related to this disease. So like I said, it's the small joints within the body. Sometimes it go up the elbow. It usually goes within all the small joints in the body, like say the feet, the toes down there. You can get it in the spine, but it's normally isolated up here to C1, C2, right up here in the top of the spine. Osteoarthritis would be more lumbar spine, so the lower back, thoracic spine, as opposed to rheumatoid arthritis. So we wouldn't really see much of it in the spine. So how do we know if we have this disease? What should you do? Well, like I say, there's no specific test for the disease. There's some blood work that we can do, some labs that we can do, that your primary care physician or your general practitioner will run to see if you have this disease. And they'll be looking for some markers like your rheumatoid factor, your erythrocyte sedimentation rate, or your CRP. And these are all just fancy words for basically they're looking for some signs in your body that it's actually inflammation that is causing you the pain in the joints. Now, like I said before, osteoarthritis is monoarticular. It normally only hits one joint, while rheumatoid arthritis is normally a few different joints. Plus, on top of that, we can have extra articular manifestations. This basically means that we can have stuff that happens outside of the joint. So say in our eyes, we can get dry eyes with rheumatoid arthritis, which is known as Sjögren's syndrome. We can get Raynaud's phenomenon, which is basically where the extremities on our fingers and our toes can go cold due to like a tightening in the blood vessels. We can get lung and heart conditions such as pleuritis and pericarditis. And these extra articular findings are all clues for either your general practitioner to pick up on, or if you come to physiotherapy, that we might try and think of isolating you from one condition to the other, okay? So basically that's the criteria. You need 4 out of 7 on the criteria. And also you might get some nodules on your elbow, which is known as rheumatoid nodules, just there in the elbow. That's also a telltale sign. But most importantly, you need to have the symptoms for greater than 6 weeks, okay? If you have the symptoms for anything less than 6 weeks, it's unlikely that it is rheumatoid arthritis. But what will probably happen is your doctor will send you for a radiograph or an x-ray to check out the joint space to see what's going on. With osteoarthritis, we see a lot of narrowing in the joint space as the two bones come together. With rheumatoid arthritis, we'd probably see a lot of erosion within the bone, as well as we might see some inflammation. Okay, so let's talk about a little bit of the medication that you take. So for rheumatoid arthritis, unfortunately, there's no cure as of yet. The people are researching as we speak, trying to come up with a cure, but there's a lot of medication that will hopefully prevent this relapse remission of the disease. Basically, the way the disease goes is you can have exacerbations where it goes bad for a while and then it remits, it goes back, and you're okay, you're moving around, things feel a little bit better, the morning stiffness is a bit better, and then it goes back again to this exacerbation. So with a lot of the medications, they're called disease modifying anti-rheumatic drugs, which is a mouthful. They shorten it to DMARDs, and basically these are designed to limit this progression of pain and inflammation and joint destruction that happens in rheumatoid arthritis. You can also take a normal ibuprofen or NSAID, non-steroidal anti-inflammatory drugs, which is there for pain and inflammation, but it doesn't do anything to reduce the progression of the disease. But like I say, with medications, you need to talk to your general practitioner if you have rheumatoid arthritis, and they will probably put you on the best one that's suited for you, with taking the side effects into consideration. But what we really want to talk about is what exercises can we do, or should we do exercise with rheumatoid arthritis? Yes, definitely we should be doing some movement with rheumatoid arthritis, because unlike osteoarthritis, with rheumatoid arthritis, the more activity you do, the better it feels, okay, within the pain-free range of motion. So we want to do some exercise to increase the strength, the range of motion, just the general flexibility within the joint. And I've here one of these power grips, so you can see like that, and even just stuff like that to strengthen up the hands, strengthen up the fingers, okay? We want to work within that pain-free range. And when you come up to the clinic, we'll be doing specific exercise after we've done a thorough physical examination on you to make sure that there's no contraindications to doing these exercises. And then you just see here like that, just any kind of movement like that, just get these joints moving, okay? Now sometimes in the clinic we do a little grip strength, so something like this just to check the strength in your wrists if you have rheumatoid arthritis in your wrist, and that can be a good exercise too. But basically with rheumatoid arthritis, we've got to get a bit of movement. So even if you can get in the water, do some deep water jogging, a nice bit of swimming or biking, everything within your own pain-free zone is going to be good. It's going to cause a little bit of pain, but we don't exacerbate that pain. And that's why when people come up to the clinic, we'll do a thorough physical examination of you. We'll see what's moving and what's not. Often with rheumatoid arthritis, unfortunately, you get deformities. You can get stuff on your fingers called swan neck deformities, which is hyperextension of this joint, and then this joint goes in down like that. So obviously with all that inflammation that's happening there within our joints, we can be left with fixed deformities. Sometimes ulnar deviations, or a hand might go to the side, and then we'll have this swan neck and sometimes a button ears deformity. But I don't want to get over technically with you. I want to leave you with this final point, and that really is, with rheumatoid arthritis, it's an inflammatory condition. Osteoarthritis is a degenerative condition. It's more to do with weight bearing. It's usually one joint with osteoarthritis, many joints with rheumatoid arthritis. We get extra-articular manifestations with rheumatoid arthritis. It can affect other stuff outside of the joint. We need to get on medication as soon as possible, which means that if you have any of these symptoms that I talked to in this video, please go to a general practitioner, get checked out, and they might refer you on to a rheumatologist if they think it is a rheumatoid condition. If you're already diagnosed, you've already been to a general practitioner, please feel free to come up and see any of our chartered physiotherapists here at the clinic, Trish, Emmett and Emer, and we'll be only more than delighted to assess and to treat you and come up with a good long-term strategy plan for rheumatoid arthritis. Although it's not a curable disease as of yet, it's definitely a disease where it can be managed appropriately. We can definitely limit the amount of functional disability that you have due to rheumatoid arthritis. Thank you very much for listening to this initial first video from the education zone at physiogoa.ie with me, Fergal Garrity. If you have any questions or queries, you can just send it on the email below. Unfortunately, I can't take the time to talk about specific injuries, but if there's some topic that you'd like me to cover, please let me know, and hopefully I will see you all very, very soon back at Galway.